Hello everybody, this is Kumar Mohit. I'm a student of medicine here at University of Proprioception Health System Delta, Jonelta Foundation School of Medicine. So today we are going to demonstrate to you about the in the neurologic examinations, the sensory system examination, and with that we are going to demonstrate you the different kind of the reflex of our body. Okay, so let's go. First one is the sensory system examination. So for the sensory, which we know the sensory part is when we get any stimulus on our body, then it will go towards the brain. So this is the sensory system. So what we are going to do, we have to just follow the upper and lower extremities sensory, and we have to follow the different kind of the dermatomes as well while performing the different kind of the reflexes. Okay, so for the sensory, what are we gonna sense? We're gonna sense the point, like the sharp or dull, or like the soft touch, like the vibrations. We can feel the vibrations. So for that we have the tuning fork here with me, and we're gonna just make it the cold and the hot differentiate as well. Okay, so let's go, and I'm gonna to introduce you with my patient so for today's demonstration I have with me my patient. So would you please tell me your name and age?
My name is Narendra Kumar. My age is 22.
Okay, do I have permission to just check your sensations with the sensory system?
Yes.
Alright, thank you so much for giving me permission. Now we are starting this examination or demonstration with the soft touch. Means I'm gonna just touch you with the help of this silk, and you have to tell me whenever you feel that I'm touching you. Okay, you have to say now. Okay, so please close your eyes.
Now. 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 Now.
Okay, it means this soft touch is fine. Now we are gonna do the you have to tell me I'm touching you with the sharp object or a dull object. Okay, okay, sure. I have with me these are some fibers which here are the sharp object. So okay, close your eyes please.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, so that's also fine with sharp and dull. He is able to recognize the sharp and dull. So now what we are gonna do, we are gonna just check his dermatomes with the help of the hot and cold water. Okay, so I have two glasses here. One is with the hot water and one is with the cold water. Okay, so now you have to close your eyes. Okay, and tell me which one is hot and cold. Okay.
Start.
So will you please close your eyes? Okay, let me start.
Cold. Hot. Hot. Cold.
Okay, it means you are able to discriminate that properly. Okay, so I'm gonna to examine for the vibrations. His body is able to sense the vibrations or not. So we will just try it from the distal phalanges or the distal, a big thumb from the legs, and then we will go for the hands as well. Okay, so you have to close your eyes and you have to tell me when you feel the vibrations or not. Okay, so let me start this one. Do you feel that?
Yes.
Okay, so he is perfectly feeling the vibrations, so it means his dermatomes are perfectly fine. So now we will go for the hand as well. So close your eyes.
Yes.
Okay, so it means both the upper and lower extremities are feeling the sensation properly, vibrations properly. Now we are going to do the proprioception examination of our patient. So what we have to do, we have to just catch the thumb of our patient, and we have to tell him that this one is up and this one is down. Okay, tell me whenever I'm doing up or down. Okay, close your eyes. Now we begin.
Down. Up. Down. Down.
Okay, so it's perfectly fine. We will do with hand as well. Okay, close. Give me one finger like this. Okay, tell me up or down. This one is down, this one is up. Okay,
Start.
so you have to tell me up or down. Okay,
Up. Down. Up. Up.
okay, so Now we are gonna do, tell me up or down, okay? Close your eyes.
up, down, down, up.
Okay, it means it's perfectly fine. I'm just doing it on one hand or one leg. You have to just do on the both, okay? So now for the next step, for the sensory examination, we are gonna do the discriminative examination. He have to recognize. So for that, we are going for the first step. That's the stereognosis. What we are gonna do? We are gonna just put some familiar things in the palm, and he have to recognize by the feeling it. Okay. So will you please close your eyes? I'm gonna put something in your palm, and you have to tell me this is what is this, okay?
It's going
Small or big?
small.
Okay, this one,
Coin big.
big coin.
Yes.
Okay, it means you are gonna recognize it, so it's perfectly fine. Now for the next step, we are gonna do the graphesthesia, means we have to just write something here in the palm, and he have to recognize that what number I have written in the palm. Okay. Some people who are not able to recognize it, they are known as the agraphesthesia. Okay, but let's check this one. So close your eyes. I'm gonna write some number on your palm. You have to tell me what number I have written here. Okay.
4, 3.
Okay, so he's perfectly fine. 4 and 3, he recognized the numbers. Okay, so here I have two fibers with me. These are the sharp fibers. So now we are going to do the 2-point discrimination. Is he able to recognize the point 2 or point 1? Okay, at the time when we are gonna he's gonna sense it. Okay, so let's go and do this. We have to make sure that the distance between 2-point minimum, it should be about 5 mm, less than the 5 mm. Okay, so let's go for it. You have to tell me, okay, you are feeling the 2 sharp points or the 1. Okay,
2, 1, 1, 2, 2.
okay, so he was able to recognize it. That's the perfect. Now we are gonna do for the next step, that's the point localization. I'm gonna touch you on your body somewhere, and you have to just tell me where I have touched you. Okay, so close your eyes. You have to recognize the point. Tell me.
Forearm.
No, by sign, by your finger. Tell me. Okay. Here. Okay. Here. Okay, that means he is able to recognize the point properly. Now what I'm gonna do, touch your you at 2 points simultaneously, and you have to tell me where I have touched you at both points. Okay, so close your eyes. One is here, one is here. Okay, one is here, one is here. Okay, so that was the fine. He was able to recognize that 2 points as well. Okay, so we have done with our sensory system examination. Now we are going to do some reflexes. So for that, first of all, we are going to do the deep tendon reflexes. So in that, we have to follow our dermatomes like biceps, triceps. As we know, the biceps is from C5, C6 dermatomes, and the triceps for the C6, C7 dermatomes, and for the radio or the brachioradialis, it's from the C5, C6, same as the biceps tendons. Okay, so now I'm gonna do that. So you have to just put your hands like this. Okay, is it fine? Now I'm gonna do for the biceps, and I have to notice while I'm just hammering it here, I have to notice the contraction of the biceps and the flexion of the arm. Okay, so let's go for it. Adventure. Okay, we noticed that, and now that was for the C5, C6. Now we are going for the triceps. For triceps, you put your hand like this. Okay, okay, we got that triceps is contracting, and the little bit that hand was moving outward, means the extension. Okay, so that was for the C6 and C7 dermatomes. Now we are going to do for the radialis, brachioradialis. So for that, we have to make sure that we have to hit by this hammer here about the 1 to 2 inches from the thumb. Okay, so here is the thumb, about 1 to 2 inches means somewhere over here. So I have to just hit here. Okay, so that's the perfect. That was for the brachioradialis dermatomes. Okay, so that was same as the C5 C6. Now we are going to do the knee reflex. So we have to make sure that we have to hit it at the proper place, means on the tendons. So where this is the patella, so we have to just hit it below the patella. Okay, we have to make sure this one, and we have to notice the reflex, and we have to also notice the rhythm of the flexion and the extension, and how much time it is taking to come at the normal position as well. Okay, so let's go for it. Okay, this one. Okay, so means these reflexes are proper. So this one was the knee jerk reflex. Now what we are gonna do, we are gonna do the ankle reflex. So for that we have to hit on the ankle, means the back side of the feet. Okay, so let's go for that. So we are gonna do the ankle reflex. Okay, let's see. Okay, so that was for the ankle reflex for this one. Okay, now we are going to do the other type of the reflex, that is the cutaneous reflex. So for that, what we're going to do, we have to just first of all observe this place, come near. So we have to just move object from here, and we have to see the movements of this umbilical. Sometimes it's happen like umbilical is moving towards the object where we are just touching it. Okay, and we are moving it. Okay, so that was this one. Now we are going to do the another reflex test, that's the for the plantar reflex, and that is called like the Babinski sign. So for that, what we have to do, we have to move this this blunt object from the lateral side of our feet, and then what we have to do, we have to go medially towards the big thumb. Okay, so let's go for that. We have to see that the movement should be at the plantar side. Okay, so that was fine. So we have seen our patient was negative for the Babinski sign as well. His feet was moving at the plantar reflex properly, so there was no issue. Now that all regarding the part of the reflexes and the sensory system of our body. Thank you so much for watching it.